Welcome everybody to the live event sponsored by Frontier Nursing University for Nurse Practitioner Week. The title of this session is Navigating a Nurse Practitioner Program. Your hostess are myself. I'm Dr. Lisa Chappell, the Associate Dean of Family Nursing, and
I'm Tanya Nicholson. I'm the Associate Dean of Midwifery and Women's Health here at Frontier. There are pictures. Yay!
There we are.
So we want to tell you a little bit about if you are a student here at Frontier or if you're considering coming to Frontier, who your team of people are that you would interact with and that would be your support during your stay here with us as a student. So first you would have an associate dean, either Lisa or myself, and we're the associate deans. So dependent upon the department that you're in, you have a specific associate dean. And then there's also a clinical director as well assigned to each department. So Dr. Jane Houston on your bottom left, and then Dr. Irma Jordan, bottom right, are the clinical directors. Jane is the clinical director for Midwifery and Women's Health, and Irma is the clinical director for Family Nursing. And then obviously you have course coordinators and course faculty within each of the courses. There are regional clinical faculty members who are out in the communities who serve to work with students while they're in their clinical practicum as well as in preparation for that. You have a professional advisor that is assigned specifically to you, financial aid officer, and credentialing coordinator who helps with the paperwork as you're in and getting ready for clinicals. So we very specifically give you a team of people that support you and help you to be successful as you move through the program here at Frontier.
Tanya and I, as associate deans at Frontier, have different roles with the students depending on what their needs are. One role that I particularly enjoy is working with students as an advisor, how to be successful in graduate school, how to progress through the program. Tanya, what about the role of the counselor?
Well, up on the upper right-hand side up there, you can see that sometimes our role is about just counseling you about your personal life and your professional life and your school life as to how to find success in that, ways to avoid failure, and things that you can do to alleviate some of the stressors that are going on in your life. Sometimes, though, my favorite role, Lisa, is the cheerleader role. Shocking true story.
Well, what do you,
We're going to tell you a little bit also about what the clinical directors, Jane and Irma, do. Their roles as clinical directors are specifically to be in charge of the clinical portion of the program so that they work with you and with the regional clinical faculty and the preceptors to make that part of your journey smooth and successful. So if there's a concern during clinical or in preparation for clinical about how to get there, what to do when you get there, if there's a bump along the way, maybe a personality conflict with a preceptor, or just a concern or a question about how to move through the steps appropriately, Jane and Irma help to fill that void. They oversee the regional clinical faculty, so they are your direct link to administration while you're in the clinical portion of the program. You know, sometimes we lay out our plans for life, you know, like the picture on the top, we start here and then I want to go to there. Well, that's my plan. But the truth of the matter is that life moves about like this. And so we want to talk to you about how to maneuver some of those pitfalls and how to avoid some of them so that you can be successful as you move through a nurse practitioner program. So some of the things that there's no excuse for playing dumb here. So we're going to give you a lot of treats and tell you a lot of things so that you can be successful as you move through this experience in learning and in work. Because here in this situation, your job is to work. Your job is to learn and to be a student.
Be prepared to see the world differently. Allow your education to change you. You may have some discomfort along the way. I would bet that most of you are experts in your current clinical practice. When you enter graduate school and begin to learn how to become an advanced practice nurse, you will be uncomfortable. You will be a novice. So allow yourself the time, give yourself permission to be a student. Keep an open mind to all possibilities.
I think that is so hard, Lisa, to be back in that role of discomfort and unsure of yourself. And I think one of the mistakes that students sometimes make is wanting to prove everything that they know as a nurse. But don't do that. Let yourself not know so that you can learn what is available.
Right, right. Salvador Dali says, have no fear of perfection. You will never achieve, you'll never reach it. You know, we're all learners. We're all on the path of learning, and we're all a work in progress. Your attitude is so vital when you are a graduate student. You remember in your associate degree or your BSc and how everything was very concrete. Everything was black and white. Well, in graduate school, things are more abstract. You'll see that it's not black and white anymore. There are many colors. So have tolerance for different viewpoints and the abstractness of being a graduate school. Seek excellence, not perfection. And this, I remember feeling like this as a nursing student, nursing school, where every answer is correct, but you're probably still wrong. Learn to think critically while you are a student. This is something that we really focus on developing at Frontier is critical thinking, the ability to critically evaluate a patient situation and to practice at the advanced practice level. It is a skill that you'll work on developing, and in the end, you'll be ready for the comprehensive exam, the certification board, but most importantly, you'll be ready for delivering care as an advanced practice nurse.
That's true, and along the way, some of the additional things that you can do besides your, quote, regular and required schoolwork is to look out into your community and figure out how you can take the things that you're learning and apply them. You might seek out support groups of nurse practitioners, professional groups. You might volunteer in a birth center or a homeless clinic or a homeless shelter or wherever, places that you can take some of the knowledge that you're growing and see how it works out there in the real world. Now, we do not want you to do this at sacrifice of your schoolwork time. But if you have additional time in your schedule, or if you, as you are trying to establish relationships out there in that community, getting out there, having your name to become known is a very valuable piece. Very often, the nurse practitioner organizations would welcome a student amongst their ranks at their meetings to talk with them and learn from them. They would love to hear from you. And don't forget the people that you meet here. So if you are currently a Frontier student, be sure that you are looking at the people that you met at your Bridge Bound or your Frontier Bound or your DNP Bound. Look around at those people. Use the strengths that they have to support you. Hold each other accountable. Know one another in a way that makes you want to support each other's success. We know that very often the student that is struggling is the student who is not in communication with others. So if you can establish relationships within your Frontier community and without, you're going to have a much higher success rate.
And as a student, learn to say no to unnecessary craziness. Try to distinguish the signal from the noise and learn to say no. It is okay to say no, and protect your time and spend it wisely. Be professional in your communication and try not to get caught up in a lot of the infectious chaos that you may see on Facebook or other ways of communication. You're becoming a leader as an advanced practice nurse. Surround yourself with those on the same mission as you. During your time as a graduate student, you will meet many people who you should form a relationship with. The other students that you are in class with, your faculty, your advisors. When you start precepting, when you start precept and form, look for preceptors that have the same mission as you in providing patient care. They will be a great resource for you. And I can't encourage you enough to develop a schedule, an organized schedule for your life as a student, your life as a working nurse, and your home life. Allot time for the things that you know, and try to fit in there somewhere some time for yourself, because you cannot pour from an empty cup.
That's so true.
And this is a picture of my social life during nursing school.
And that was mine too. Actually, this is what mine looked like.
When you are a graduate student, learn to say no, spend your time wisely, and do take some time to have to yourself. But remember that you only have 24 hours a day, and you've got to make decisions about how you're going to spend your time as a student, and as most of us work or had to work when we were students. So you may have a decreased social life, and that's temporary.
You know what's funny, Lisa, is my son's girlfriend and I were talking last night, and she's in nursing school right now, and her success this semester is stellar in comparison to last semester. And I said, you know, what is the difference? My goodness, you're doing so well this time. And this is what she said. I'm only going out with friends one night a week now.
Oh, there you go. That was smart.
Good for her, right? Very
good for her. And I love this saying, I feel so energized after that 12-hour shift, said no one ever. We really encourage you to think about your work commitment. It is extremely difficult to be a full-time student and work full-time. We do have students that do it, but really be smart about how you're going to spend your time. So look at, how could you consolidate your work hours? Could you go to 3 12-hour shifts? I've seen students change their work situation so they can go to school. Instead of working 5 days a week, maybe they do go to 3 12-hour shifts. So think about how you're going to combine your work life and your school life.
Something that just came to my mind as I was thinking about that is that also think about how you're going to work your study time. Because to think that you're going to take a 12-hour day and use that as your 12-hour day off, you're going to use that and study all that 12 hours is not extremely reasonable either. It's very difficult, if not impossible, to really spend 12 dedicated, valuable, effective hours studying. Most people's brains don't work that way. You can study better in smaller segments with good breaks in between. So the idea that you could dedicate 12 really effective hours in one day to study is not reasonable.
That's so true.
So I want to talk a little bit about being reasonable about your home life. So Lisa was talking about your work life. I'm going to talk about your home life. The priority that we have for you is that you are a well-rounded, happy person that also is a nurse practitioner practicing somewhere and serving women and families and making a difference in the world. What you do in your home life matters, though. Your family has to be a priority, and making sure that you don't forget that. Like, don't pencil them in. They deserve a pin mark on your schedule. They deserve the best of you. And then your work time and your school time come in there together after that. But making sure that you honor and remind yourself that you have to do that, because if not, something is sacrificed when you add something new like school into your schedule. Don't let it be your family life. Now, along that same line, you have to take care of yourself. So if you're going to be productive mentally, you have to be in physically good shape. So that means you've got to do the things that you learned in kindergarten. You've got to eat good, you've got to sleep well, and you've got to move around some. And so I recommend that you remember that every day, that if I'm going to be able to take care of not only my family, but other families as a nurse practitioner, I have to do what I can to look after myself and keep myself healthy. To have a strong and fit mind, the best thing is to have a strong body to support it. And don't forget, sometimes you just plain need to shut down for a few minutes. Sometimes you just need to hibernate. And so even if you have to schedule that in, don't feel guilty to allow yourself that time to do nothing.
In your schedule, allow enough time to complete your task, but factor in break time. Tanya's very right. 12 hours of studying is, that can be mind numbing. So take a break every couple of hours, go outside and take a walk, or play with your children, or something that kind of gives your mind a rest, because 12 straight hours of studying is very hard to be productive toward the end. So take periodic breaks while you're studying. And I just say, I felt like this little person right here. The semester's over. Where's my family? When you are on break, whether you're in a university where there's terms or quarters or semesters, take some time away from school. Take a trip if you're able. Go do something and have some fun. If you have children, spend time with your children. You need that break from school. You need the ability to rest your mind and refresh your mind and come back rejuvenated. And don't think that the break is really so you can work ahead for the next term. Give yourself some time to be away from school while on break.
I'm going to talk a little bit about ways to make your study time while you're in distance education most productive. So ways that you can make this work the best for you. One is to be a scheduler. Get yourself a great calendar. I personally, because at the university we use Google, I use the Google Calendar. I do not recommend having a separate life and school calendar. Combine the two. The truth is, everything you do is a part of who you are. And so if you take that calendar and you try to separate it, you're going to miss something along the way, or you're going to overschedule yourself and double schedule yourself, and you will only be frustrating. It will not be productive. So take your schedule and put it together onto one calendar, put everything onto one so that you can see at a glance everything that's happening. And sometimes taking larger tasks and breaking them down into small tasks. First off, it makes it a little bit more doable and manageable, and it also helps to make sure that you're moving along whatever the task is. When you first get access to your course, going into that syllabus, and I always laugh at this because it's in the syllabus, that's the answer to every question that's in the syllabus. Take a look at the syllabus. But the truth is that very often that is the truth. And so if you will be sure to get that syllabus down, if you need to print it out, do whatever you have to do so that you can refer to it regularly. You take and translate the dates onto your calendar. You break those assignments down into small pieces and schedule that onto your calendar. When I was recently, just a few years ago, studying for the Women's Health Nurse Practitioner exam, that's the way I worked my study plan. I looked at the big picture, one section at a time. I broke it into small pieces. I took those small pieces and put them onto a calendar. On Monday, I'm going to spend 2 hours on X topic. These are the pages I'm going to read. These are the questions I'm going to answer. On Tuesday, I'm doing this next. And it was like a contract with myself. I promised myself that that was what I was going to do. And if I didn't do it, I moved it to the next day so that I could move on with it and continue to accomplish what I needed to meet the big task at hand. Another important thing is to have an actual designated area that you do your schoolwork. Now, everybody's home environment might be different, but on almost any situation, you can find a small amount of space that you can designate as your area. I have known of people that took a closet and converted it into a small office area so that they had a private place that they could go be quiet and work on their assignments and do their readings, and it helped to avoid possibly being in the bathroom taking a test or a nap. And so I'm going to suggest that you make sure that that study space is appropriate for testing when you're in a distance program like ours. And if you're a Frontier student, there are Proctorio guidelines that we expect you to follow for testing, and that would include being in a quiet testing area, preferably not a ladies' room. And one of the self-care tips that I try to follow myself is to combine activities when I can. And one of those for me is I do some work and some fitness things together. So I very often in the mornings get on the treadmill excuse me, with my computer and answer email. There's some things I cannot do there, like if it's something that takes a lot of brain power, my feet have to be sitting on the floor in a very specific part of my house. It must be the smart part of my house. But if I'm just answering routine emails, I can do that from the treadmill. So there may be some things that you can do like that. Maybe you can do your readings, or maybe you can take easy notes, or watch Big Blue Button recordings or something like that. But finding ways to combine things so that you're optimizing your time.
And know your resources. Every university has a student service section. What do they have to offer? What kind of work do they do with students? Could you learn better test-taking techniques there? Could you learn better study techniques? Know your resources, whether it's student services, the librarians. We have excellent librarians here at Frontier, and they are just a great resource for students. Our academic advisors here at Frontier are an exceptional resource for students and for faculty working with students. Our IT department here is probably the best that I've ever seen, and they are a great resource for students and faculty while they're doing their work.
As demonstrated by the presence of Adam, IT man.
And then your faculty. This is a picture of the Frontier Nursing University faculty from 2015. This is a really great resource because faculty want to see you succeed, and they work so very hard to develop their courses and deliver their courses to create clinicians, to create advanced practice nurses. So don't forget your faculty as a resource.
You know, I always like to say when we think about our faculty, the depth and the breadth of the experience of our faculty is phenomenal. You have to think that this faculty, first off, they're either family nurse practitioners, are certified nurse midwives, or women's healthcare nurse practitioners, or some combination. Some are all three. And so the experience of all of these faculty, this is at your fingertips. You have the experience of the benefit of their experience from different geographical areas, from different practice type settings. It is really amazing and unprecedented in most universities.
Also at Frontier, we have a program called Student Connections. If you're a student at our university, you'll get announcements about these sessions where we group courses together, and we come together with faculty and students, and it really is a review and presentation of the courses and tips for students to succeed in those courses.
And this is just an example of several that we do. Here's another example.
Right.
This is for the clinical courses.
Right, clinical courses and some of the more general courses that all students have to take.
So as we get ready to close, some things that we want to say to you is that we believe that you have the ability to succeed, but we believe that one of the most important things that we do together is that we care about one another. Nursing is based on a foundation of caring. We believe that our university is as well. Our ability to care for one another and to forgive one another and to move forward even through hard things is absolutely imperative to the profession and to the healthcare of our nation. So the little picture there that the policeman or the sheriff or whatever he is, mall cop, is holding there is the student before they start school or as they're starting. You're just a little caterpillar. You're moving along in your life, but you know, as time goes by, through the time of your education, through your study, through your commitment, through your clinical experiences, where you blossom into a butterfly, it's absolutely amazing to see the changes that occur just because of the exposure to the education and to the many resources that you have through your education. We're so excited about what you do, and we believe that you, as you are making and have made that change, you're going to do the same thing in the world. You're going to take a little caterpillar of a world, of a healthcare system that is broken and terrible right now, and be able to turn it into a butterfly. There are going to be things that are hard. There are going to be days that stink, but you have the capability within you to work hard and to overcome those things. There are no limits when a person is willing to do that. And we're thankful that we can trust that you are going to think differently than we have in the past, that your different ways of thinking and your different ways of approaching problems is going to be mind-blowing to the healthcare system and to what it means to our children and our grandchildren. We're excited that we can trust you with that.
And this is where we'd like to see you coming across the stage, getting hooded. This is Dr. Nicholson hooding a student, but in celebration of your achievements and your accomplishments, and to obtain your degree as an advanced practice nurse and move out into the world as advanced practice nurse.
And once you graduate, you can show up at your interview and put the pieces together. We hear from employers all the time at how pleased they are with our graduates, that you're able to walk in and start working, that you can make a difference at the individual bedside, and then now we hope with the doctoral program you can also make a difference in the system and in the community that you're in. We're so proud of what you are and what you're becoming. So if you have any questions, we would love to hear them. So feel free to type a question in if you have it. Otherwise, we are so thankful that you came.
Yes, thanks for coming and spending some time with us.
And know that part of your resources are Lisa and I. We're available to you, and we welcome hearing from you. Sometimes what we do is we point you to somebody. If we don't know the specific, complete, and thorough answer, we may point you to somebody else who does, but
That's right.
we'd love to be able to do that.
That's right. Liz, do you have any questions?
Thank you.
You're
Thank
welcome.
you for coming.
I hope it was helpful.